You had some problems such as swelling of your legs, excess bubbling of urine while micturating, and for that you went to see a doctor and he advised for a test called renal function test or kidney function test. The test results came back and it showed your creatinine to be high. Now you're worried. If that's the case, then this video might be for you. Hi, I'm Dr. Diwakar Manandhar, a licensed nephrologist working in Nepal, and today in this video we will be talking about what creatinine is and what are the reasons why it increases. So before starting this video, I would appreciate it if you would like this video, if you would share this video, and you would subscribe to this channel. Now let's get into it. Creatinine is the waste product of creatine, which is made by the body, which produces energy to the muscles. As creatinine is produced, it slowly starts to build up in the bloodstream and it gets excreted via urine from the kidneys. Creatinine rises if there is overproduction by the body or if there is under excretion by the kidneys. As it is formed from the muscles, a muscular person will have higher creatinine level as compared to a lean, thin built person. And similarly, a male will have higher creatinine as compared to a woman. And similarly, if somebody's kidneys are not functioning well, then the production of creatinine, which is a continuous process from the muscles, cannot get excreted out of the body, which leads to increased buildup of creatinine in the bloodstream and hence rise in creatinine. Today in this video, we will be talking about what are the reasons for sudden rise in creatinine whose creatinine was normal to start with. We can broadly categorize this into three components. One is called prerenal AKI, number two is called renal AKI, and the third is called postrenal AKI. Now let's start with prerenal AKI. So what is prerenal AKI? It is a condition where there is limited flow of blood to the kidneys, which causes decreased filtration of the blood and decreased formation of urine. The body cannot excrete waste products in the form of urea, uremic toxin, and creatine and other waste products in the urine because the urine amount is very low, because of which these toxins gets accumulated in the blood, which causes rise in urea and creatinine. Now, what are the conditions that might cause prerenal AKI? Number one, it could be diarrhea, where the body is losing fluid from its stool. Number two, it could be vomiting, where fluid is getting lost from vomitus. Number three, if the heart cannot pump adequate amount of blood, if there is heart failure, then less amount of blood is getting pumped into the kidneys and hence urine is not able to be formed. Similarly, liver failure also can cause prerenal AKI because there is decreased effective blood volume in the blood vessels. And lastly, due to some drugs such as NSAIDs, which are painkillers, and some antihypertensive medication which can cause decrease in blood pressure leading to decreased blood supply to the kidneys. The second cause is renal AKI, where the problem lies within the kidneys and its structures such as glomeruli, blood vessels, interstitium, tubules. If there is problem during functioning of each individual component or components combined, it can lead to rise in creatinine levels. Now the reason for this could be very high blood pressure, or we can call it as malignant hypertension or hypertensive emergency, where the patient can present with thrombotic microangiopathy leading to rising in creatinine levels. Number two could be glomerulonephritis, which is a condition where there is loss of protein in the urine. Third is tubular interstitial nephritis. This might be due to various reasons such as endogenous and exogenous toxins. Endogenous toxins are the toxins which are produced within the body. For example, myoglobin from rhabdomyolysis, hemoglobin from hemolysis, increased uric acid production from the body, and in some hematological malignancies such as multiple myeloma, formation of casts that are obstructing the tubules. Now the exogenous toxin could be in the form of antibacterial, antifungal, antivirals, or other medications, which can cause decreased functioning of the tubules and inflammation of the interstitium, causing rising creatinine levels. And lastly, a rise in creatinine levels can be due to postrenal AKI. In this condition, the blood supply to the kidney is very good. The kidney and the structure within are functioning very well. But the problem lies in the pathway for flow of the urine, which are ureters, bladder, and urethra. These are the structures through which urine gets passed out of the body after getting formed from the kidneys. The obstruction could be structural obstruction or it could be functional obstruction, where there is no demonstrable cause for obstruction. In case of structural obstructions, the lesions could be due to stone, due to any malignant growth within the structures, due to any blood clot, or if there is narrowing of the pathway, or if there is any strictures formation. In case of males, it could be due to benign enlargement of prostate, which can cause obstruction in the flow of the urine. Now, in case of functional obstruction, there is no demonstrable cause, but the lesion is due to problems in the nerves that are arising from the spinal cord. It might be due to traumatic injury that is present in the back. It might be due to compression of these nerves from prolapsed intervertebral disc. So because of this neurological issue, the bladder is not able to contract and propagate the urine out of the body. Hence, the urine gets retained in the bladder, leading to decreased forward propagation of the urine that is formed from the kidneys. Now, because of that, there is decreased flow of urine out of the body, leading to decreased excretion of all the waste products in the form of urea, creatinine, which leads to rise in those levels in the blood. So these are the reasons why creatinine rises in the body. If you have a similar issue, please write in the comment section which among these reasons are causing your creatinine to rise. I hope this video has been helpful to you, and I cannot wait to see you in the next video. Until then, peace.